Hello everyone, welcome to another video from Bun Med where we discuss concise medical knowledge you can fit inside of a bun. Today we will be exploring the disease profile for non-Hodgkin's lymphoma. So, non-Hodgkin's lymphoma is a condition that typically occurs more in the older population, so it's unlikely to be seen in patients younger than 50. Secondly, it occurs in males more often, but with regard to the risk factors, this varies by the type of non-Hodgkin's lymphoma, so I'll come on to that in a moment. Now, when it comes to the symptoms, the symptoms are typically pretty similar. So again, you may have painless rubbery lymphadenopathy. However, the association with alcohol is not as commonly seen, if at all. However, you can also have the B symptoms, so the fever, night sweats, and weight loss. And there may also be organomegaly with anemia and low white cell counts. Now, the other thing with non-Hodgkin's lymphoma is that typically the spread is more random and it usually presents with more metastatic disease. So the patient may have abdominal symptoms, for example, if the GI system is impaired. So if the lymphoma is causing an obstruction, then it may cause abdominal pain. The patient may not be going to the bathroom as often. And it can also cause chronic bleeding, which may lead to an iron deficiency anemia. So when you see an iron deficiency anemia, you're thinking a microcytic anemia. If the bone marrow is affected, this can again affect the production of red blood cells, white cells, as well as platelets, and so you may develop a pancytopenia. And it can also affect the critical sites such as the central nervous system, and so this may cause headaches and spinal cord compression symptoms, which would need urgent treatment. Now, again, when it comes to investigations, these are very similar. So you want to do a full blood count to look for any anemia or any white cell count which is low. You want to do your baseline kidney and liver function tests. Again, a blood film may show a leukoerythroblastic film. And you can also conduct biopsies, chest x-rays. And just like before, you want to stage the patient with the Ann Arbor staging using CT and PET-CT. Okay, now when it comes to subtypes of non-Hodgkin's lymphoma, there are over 30 odd. And I personally would not learn all of them, but there are a couple of important ones that you should know. And essentially with the subtypes of non-Hodgkin's lymphoma, it helps to split them up into how severe they are. So indolent, aggressive, and highly aggressive or very aggressive. So let's have a look at an example of an indolent lymphoma. And the most common type here is follicular lymphoma. And in this type of non-Hodgkin's lymphoma, we have a translocation between two chromosomes, which is 14 and 18. And because you have this translocation, it results in overexpression of the BCL2 gene. Now, this gene normally inhibits apoptosis. So, thinking about it, it stops the cells from dying. So, essentially, what that means is that we have too much inhibition of the cells dying, and therefore not enough cells are dying. So if there is a cell which has a mutation or cell injury, that cell may be allowed to continue to divide. And this is a problem because it means that the risk of developing lymphoma is greater. Now, when it comes to B cell versus T cell, in the case of follicular lymphoma, we have B cells that are commonly affected. Another example is marginal zone lymphoma, and again highlighted in red is a key exam point here, which is that it is associated with H. pylori. And this particular type of lymphoma is going to affect the mucosa-associated lymphoid tissue, which is what MALT stands for. And again, it's typically the B cells that are affected. Now let's have a look at an example of an aggressive lymphoma. And here we have diffuse B-cell lymphoma. And of all of the lymphomas, whether they be indolent, aggressive, or highly aggressive, diffuse B-cell is the most common in the UK. And as the name suggests, it typically affects the B cells. And then we have very aggressive lymphomas. And in this case, the key example is Burkitt lymphoma. This is a lymphoma that occurs because of a chromosomal translocation between chromosome 8 and chromosome 14. And it causes overexpression of the MYC gene, which means that there is increased cell division and again increases the risk of lymphoma. Now, when it comes to the symptoms of Burkitt lymphoma, this is quite interesting because it will depend on the location. So, for patients who are within Africa, it typically has a greater, the lymphoma will typically affect the jaw more often. And the role of EBV is quite high. So, there appears to be a very high association to Burkitt lymphoma with Epstein-Barr virus for patients who are within Africa. This role is, or this association is much more weaker for patients who develop Burkitt lymphoma outside of Africa. Additionally, they typically have more abdominal symptoms, so they may have abdominal pain and rectal bleeding, constipation, etc. And typically, this lymphoma is found in immunocompromised patients, such as those with AIDS or HIV. And when you look under a microscope, then, excuse the drawing, but you will see a starry sky appearance. And again, this is an important point for the exams. Okay, and just to finish off, we have the T-cell lymphomas. And again, there are three key ones to think about here. The first one is HTLV1 T-cell lymphoma. And this T-cell lymphoma is caused by the human T lymphotropic virus. Next, we have enteropathy T-cell lymphoma, and this is associated with celiac disease. Finally, we have mycosis fungoides, and this characteristically involves the skin. And typically, patients may present with discoid-shaped lesions, and here it's quite specific to the mycosis fungoides. Okay. Finally, we'll talk about the treatment of non-Hodgkin's lymphoma. And just as before with Hodgkin's lymphoma, the key mechanisms of treatment are chemotherapy and radiotherapy. So with chemotherapy, the agents used are slightly different compared to Hodgkin's lymphoma. So R-CHOP or CHOP are the key chemotherapy agents used. So we have rituximab, cyclophosphamide, doxorubicin, vincristine, and prednisolone. And again, you would consider radiotherapy if needed, and also supportive care. So that's everything for today. Thank you for watching the video, and feel free to leave any questions or comments below. Otherwise, it would massively help us if you could like and subscribe to the channel. See you next time.